reciba, por favor, Dr. Paul. Gracias. Bienvenido.
Will you stay with me?
Yes, sure.
Good to see you. Thank you. Please. God be praised. Amen. Please be seated. Me da mucho gusto estar aquí con mi familia español de Lakewood esta tarde. One sentence. You know, I feel the presence of God here. It's absolutely amazing. So, I spent the last 3.5 months in Zambia, in a remote part of Zambia at Mukingi Mission Hospital. I think they'll show you where that is. I was relieving a missionary surgeon whose brother was very ill and dying back in New Zealand. I've been to Mukingi many times, but probably 6 to 8 times, and I consider them a part of my family, and they consider me a part of theirs. Most of my days were spent making rounds on the patient wards, both in the male and female and the children's, the pediatric ward, seeing patients in the clinic twice a week, teaching the nursing students and the other young doctors, the residents there, and operating, amen, and many times I had little ones that would want to help me with my rounds. Do they have a picture of that, the little ones? Did they show it? No, there's the teaching, and there's the little ones that want to help me. So we took care of many patients that had many things wrong, such as burns and snake bites and all sorts of broken bones and trauma, infections, cancers, and hernias. But one group of people that are always so grateful are the people that have the big goiters, and I do that operation often. And often these patients are suffering because they can't breathe and they can't swallow. And very often they will come back many years later to say thank you for what we've done for them. This is a sweet lady I operated on last year. She came back this year to say thank you. Pastor Joel is very well known in Zambia. As a matter of fact, many of the people that worked at the hospital would watch him early in the morning, and then they would come to the devotions that we had every day, and they would tell me about his sermon, and especially how he had joked about me. It warmed my heart to know that people still remembered and read the books and listened to the cassettes of my dad. We were very busy this trip. Most of the time, I was the only surgeon at the hospital, and for a few days, I was the only doctor at the hospital. When I finished, I counted up how many patients we had taken care of, and we'd seen 775 patients in the clinic. 500 were admitted to the surgical service, and we did 461 operations, which is very, very busy. One of the things I always like to do for the mission hospitals is to bring them supplies and equipment. And this time, God put it on my heart specifically to bring surgical instruments that they so needed. Specifically, now listen to this, specifically, I wanted to take some 7.5-inch DeBakey forceps and some Cooley clamps for vascular surgery. These are named after the famous heart surgeons right here in Houston. These instruments are very expensive, so I would go on eBay and try to buy the ones there that were used, but they were not very good quality. About 2 weeks before I left, a gentleman contacted us and said he wanted to give me a box of instruments. I'm very reluctant to take things, but I asked him to send me a picture. When I saw the picture, they were very good instruments. So I said, yes, I would love to accept them, but rather than him just send the box to me, he said he wanted to come and personally give me the box. So one morning, Mr. Bill Moore and his wife and his daughter came up to my office, and they began to tell me how for 35 years he had worked designing instruments for one of the best surgical instrument companies that there was. He told me that for 35 years, he had designed instruments for Drs. DeBakey and Dr. Cooley. The very instruments that I was praying to take with me, he had designed 35 years ago for those doctors. Mr. Moore told me how he had kept some boxes in his garage for 20 years, and he wanted to give them to a doctor with 2 provisions. Number 1, they would be used to spread the gospel of Jesus Christ. And number 2, he would get no recognition for what he did. Mr. Moore gave me not only one box of instruments, he gave me 15 boxes of the finest quality instruments you can buy, including the very ones I wanted to take with me. He gave me $150,000 worth of instruments that day. I was able to take dozens of those instruments with me, and I still have 13 boxes stored right up there. One story stands out amongst all the other stories. John was a little 4-year-old who came from a small village 2 hours away from Mukingi. He was brought in by his mother after he had pulled some hot oil on himself, and he'd burned his face and his neck and his chest and his arm and his leg. Burns are very common in Africa, and in Zambia there are no special burn units. There are no special dressings. There's no nutritional support like we have here. And often these patients will survive just for a few days, but then infection or sepsis takes their life. I sent a picture of John's burn to the main burn specialist in that country, and he said he had a 0% chance of surviving in most hospitals in Africa. But the team at Mukingi came around John. They embraced his mother and him with compassion and with kindness. We didn't have the latest treatment options, but we used what we had with diligence and with excellence. We probably took little John back to the operating room 20 times. For the first 2 weeks, we just changed his dressing. And unbelievably, he didn't develop signs of infection. And then we took him back to clean off some of the wounds to get them ready for grafting. Again, he didn't have infection. And then we grafted his arm and his hand, and the grafts took. There was no sign of infection. And then we grafted his face, and it took, and there was no signs of infection. And finally, we grafted the rest of his body, and again, the grafts took. There was no sign of infection. Finally, 6 weeks later, against all odds, because of the gracious hand of God and the tireless work of the team at Mukingi, little John and his mother got on a bus and made his way back home to his village. I was reflecting one afternoon there at Mukingi. The doors were always open to poor people. Mr. Fumpa had worked all day taking care of cataracts in people's eyes. Older men and women would be led in by the hand because they were blind, and the next morning when he took off the bandages, they would weep as they could see again. Dr. Muntali, an orthopedic surgeon, he comes once a month, and he had just finished operating on a dozen patients, correcting broken bones and deformed limbs so people could walk again. Mr. Kapai, the chaplain, made sure that every person that came to that hospital was greeted and encouraged and prayed for, and the gospel of Jesus Christ was shared with them. And I had this thought: what is happening at Mukingi pleases the heart of Jesus. The poor are welcomed, the blind see, the lame walk, the sick are treated, and the good news of the kingdom is shared with all. And all of us here at Lakewood, including my Hispanic brothers and sisters, we get to be a part of what God is doing at Mukingi Mission Hospital, far away in Zambia. If John or his mother were here today, or if the other hundreds of patients that you took care of over the last 3.5 months in Zambia, if they were here today, they would say this: Tua Santa Mwani, Lakewood. Thank you, Lakewood. Tua Santa Mwani for coming. Tua Santa Mwani for caring. Tua Santa Mwani for doing what you could do to help us. Because of you, because of your efforts, people at Mukingi and people in Western Zambia are better. Thank you very much, Lakewood Church. Can you finish one more thing? Yeah. Can I say one more thing? Let me leave you with something that's very exciting to me.
Quiere dejarles con algo que es muy
For many
emocionante para
years, I've
él.
been praying for a place in Mexico, Central or South America we could work.
Por muchos años he estado orando por lugares en
We're
México,
already in
Centroamérica.
relationship with a hospital, Hospital Shalom.
Ya está en relación con el Hospital Shalom.
San Benito, Guatemala.
San Benito, Guatemala.
Yeah. Near the Petén jungle.
Pardon?
Near the Petén jungle.
Ah, cerca de la jungla, no sé cuál. El Petén. Sí.
So hopefully next year,
Así que
when
el próximo año,
when I come visit my family,
cuando venga a visitar a la familia,
here at 2 o'clock,
aquí a las 2 de la tarde,
we will not just talk about Africa.
no vamos a hablar solamente de
We'll
África.
talk about Guatemala.
Vamos a hablar de Guatemala. Amén. Gracias, Dr. Paul.